Hello, Andrea. Welcome to the podcast. I'm so glad. I'm super excited about where this conversation is going to go today. We did a little chat ahead of time, so I kind of know a little bit about you, and we could have talked hours before, but it's like, okay, let's hit play. So let's do some recording, and we'll dive deeper into some things and let the audience hear what all we've been talking about. So welcome to the podcast.
Thank you. Thank you for having me. This is a pleasure.
So before we dive into all of the things that we want to dive into deeper, let's hear who is Andrea.
Sure. So I guess my favorite role and my most important role is a mom. I'm a mom of 3 beautiful boys. I'm a wife. I'm a pediatrician. I specialize in child abuse pediatrics, and I'm a recent children's book author.
And I love that. I love the book that you've written. Not out yet, though, right?
No, it was published, in March.
Oh, in March. I was thinking it was still to come. Okay, I didn't remember that part. Okay, well, good. So, in the first thing that you said there is a mom, and I know that was not an easy thing to become. So why don't we dive in there first, because that I think is a lot of where the book came from, and many other things have come from that. So start with kind of the struggles and then the successes about becoming a mom.
Sure. So my journey actually began a little after a year. My husband and I got married back in 2011 when we started trying for our family, and not thinking anything would go outside of what, I envisioned a plan to be. It just kind of went sideways from the beginning. So, my first encounter with a miscarriage and loss happened the first time I got pregnant, quote unquote, naturally. And that ended up in an ectopic pregnancy. So a pregnancy outside of the uterus. And from there, kind of triggered the deeper look into what may have caused it, if there's anything else that needed to be done. And that's when we had the recommendation to do IVF, vitro fertilization.
Mm-hmm. So did you lose that tube when it was ectopical?
No, thankfully I was able to treat the ectopic pregnancy with medication. It is like a medical and potentially surgical emergency. And so I was lucky enough to not have to need surgery. Mm-hmm. And everything remained intact anatomy-wise.
Good. So why did they, after that, just want you to go with IVF? Can you go into a little more detail why? I guess more, what I would say, maybe more aggressive, more advanced right away? Because we hear all the time multiple miscarriages before we even send you to, a specialist to do IVF and all that. What triggered that quicker going through the process?
Right. So because of both me and my husband are physicians, and so with our medical background, we had a little bit more knowledge, and we wanted to be on top of things a little bit more than maybe what was recommended. And so we initially met with a specialist, a reproductive endocrinologist, just to make sure we weren't missing anything. I had no risk factors. I had no setup for an ectopic pregnancy. It's something that we learn about, but I'd never seen it, and now I'm experiencing it, and there was really no explanation for it. And so we wanted to make sure that we didn't need any further testing or anything else that was required for us to just address sooner rather than later. I was also in my early 30s, and so I also knew time was not on my side.
Yeah.
And this was a really devastating loss, and we just wanted to know everything that we could know about it. And so I did testing to make sure that my tubes were okay, to make sure that my anatomy was okay, and that checked out to be normal. And they said, okay, give it a few more months of just trying, naturally, and come back if nothing is happening. And so that happened throughout the year. And so we went back to see the specialist just to get some more testing done. And so I had some testing done, blood work, and then my husband had some testing done, like an analysis, a semen analysis. And so it was actually his results that triggered the recommendation for IVF. There's a part of the sperm that helps with fertilization, and it was found to not be present in the majority of the test results that he had. And so because of that, we had a lower likelihood of having fertilization happen naturally. Mm-hmm. So they were recommending something called ICSI, which is within IVF, intracytoplasmic sperm injection, to help facilitate the fertilization process. And so that is where we were kind of now introduced to IVF, which I never even thought would be a possibility for me and for us. So that was a lot to wrap our heads around and just kind of come to terms with and find the support that we could before we started that process.
Yeah. And I'm glad that you said that, because just the simple thing that you're both physicians, so highly educated and aware, that just not totally aware, because it kind of wasn't in your medical practice. I will say, I don't know, you indicated that you're a pediatrician. I don't know your husband, what type of physician he is. The simple fact that I think, too, being proactive and getting all the tests and all of those things, and I want the listeners to know that as someone, whether you're a physician or you're not a physician, that you can guide and advocate for yourself.
Exactly.
Which is really important for people to know. Most of the time we're just like, okay, we gotta wait, we gotta have 3 miscarriages, we have to, because this is what they're saying, and that you can advocate for yourself and push a little bit on that. With some physicians, maybe not all, but with some, I think you can. And so I'm glad that you said that, and you didn't have to, like, for me, just thinking about it is enduring all of those losses before you go to the next step, I'll say. So you started that process. So walk us through that. Was there any success with or did we go to the IVF? Tell us more about it.
Sure. So I had to, they wanted to prime my uterus because I had uterine polyps. And so I had that procedure done, just all in preparation for it. And after, we had, like I said, wrapped our heads around it. We met with a psychologist. We included a few family members and friends just to have that support, that emotional support, and not really thinking that there would be any. It was almost like the solution was this, and then that's it, right? And so I wasn't really thinking that it wouldn't work, but the first round of our IVF cycle did not work. But, again, I also understand the miracle that it is to have a baby. So, we just kept moving, and it was pretty quick to move from a failed transfer cycle to the next one. It was only a couple of weeks in terms of waiting, relatively quick at the time. Very, very slow, but in hindsight, it was pretty quick to do another transfer. And so my second transfer, I got pregnant with twins. And, now all of a sudden, everything made sense. Everything was falling into place. This was the answer. Everything happens for a reason, right in front of me. Mm-hmm. And so with IVF, you have that close monitoring very early on, from the beginning, and just frequent monitoring. And so everything was progressing. We saw 2 heartbeats, and then about 7 weeks, we lost a heartbeat for one of our twins. And so that was another devastating loss. And then the following week, we lost the heartbeat for our second twin. So, now we're back to even worse, not even square one. We're back to just grief and loss and trauma. Again, just wanting the answers and wanting to know what the next step would be, because we were just, as we're grieving, we also wanted to, again, not lose time and keep moving. I elected to have a DNC, a dilatation and curettage, to do some testing if possible. Again, just to get some more answers. Testing just showed just kind of the common genetic abnormalities that would be expected, that you wouldn't necessarily test. Most people will have a miscarriage and not either know that they're pregnant or, be very early on. And, there's a statistical likelihood of genetic conditions or mutations or, abnormalities happening early on. So we underwent more testing for ourselves as well, genetic testing, just again to make sure there was nothing else setting us up that, wouldn't be seen otherwise unless we did testing. But everything was really just turning out to be normal. I had one of the levels, AMH, which tests for ovarian reserve, was found to be low for my as what was expected to be normal at my age. So mine was on the lower end. So that was more of a concern in terms of how I would respond to the medications for IVF itself and just producing eggs or enough, either quality eggs or enough eggs. And then I had some thyroid antibodies that were elevated, but wasn't showing, clinical symptoms. And so just very small things, minor things, but certain things that we could at least work towards to see if this was now the solution. But we kept going with additional IVF cycles, and these weeks then turned into months, and then it eventually turned into years. And so I had either failed transfers or chemical pregnancies where I was showing a positive result on blood tests. I had a couple of more miscarriages. It really couldn't get past 8 weeks. So I had my last miscarriage, and this was now like 2 to 3 years into the whole process. Was also like at 8 weeks where we saw the heartbeat, and then, had more testing done and everything was normal. And so after that, because we didn't do any genetic testing of our embryos, it wasn't really pushed or recommended at that time. And just, we were following the medical recommendations, and we trusted our doctor with everything in us. But there came a point where the assumption was poor egg quality based on my AMH value and based on my age, but there was no real hard evidence for that, especially since, my last miscarriage, the testing was normal. And so we did a cycle, and probably altogether, maybe like 10 or 11 or 12 cycles. I don't know. I kind of lost count, but we did one cycle where we decided to do some genetic testing, and the majority of our embryos were normal, tested normal. So that was really reassuring, and spoke against it being an egg quality issue. But then the question was, why couldn't I either get pregnant to begin with or go past, a certain amount of weeks?
Yeah, and so what did they then discover? Why you couldn't go?
Yeah, so they didn't discover anything. I mean, I had a couple more procedures done where I had more polyps removed. I tried kind of off-label medication to get my lining to be thicker, or I did some testing to see if it was like an immune issue, like an autoimmune issue or something to that effect. But nothing was really saying, yeah, this is it, this is the answer. So it was never really explained. And so with the embryos that we had tested that we knew were normal, transferred to my uterus one at a time, and still nothing was, nothing resulted in anything at that point. And even one of our embryos didn't survive the thaw because these are frozen embryos. And so it was just, again, more trauma, more grief. The doctor that we had kind of pushed it a little bit because she understood like where we were coming from, and we understood like the risks and the benefits, and she was still in the confines of what was ethically appropriate, but probably did more than most other physicians or reproductive endocrinologists would do, which I'm so grateful for. She was just giving me any chance that I could, or any opportunity to use my own uterus before, and we had already started the conversation of having a carrier, but she was giving me the opportunity to do everything that I could in our power to use my own uterus, and it just never worked.
So as you're talking about this, I'm thinking, of course, of my oldest daughter, several years, kind of the same thing, miscarriages, failed cycles, lots of embryos that developed. I don't even know now if she still has some embryos that are still frozen or not. But yeah, it's so, I don't think people understand, because when people find out you're struggling with infertility, they either say, well, just adopt or just do IVF. And I don't think people realize it's not easy. They are miracles. It's not as easy as many people think. So, so after all of that, we know you're a mom. So share with us what the next step was for you to become a mom.
So now, we had started our journey like basically 2012, and now in 2016, after we started the conversation to have a carrier, we started to look into that process. And so we had hooked up with an agency to help us with the process of, just because that was a whole other level of infertility to learn, to grieve, to process, and really just, we had no idea. We didn't have any reference. We didn't really know anybody going through any of that. And so it was a very steep learning curve. And we had this agency to help us, guide that process. And so we got matched pretty early on, pretty quickly, because the coordinator that we had, based on what she knew of us and based on what she knew of who she had, as potential carriers, she had in mind, somebody that she thought would be a good fit. And so once we started that process of meeting, reading like her profile and her reading hours and meeting and all of that, she was right. And that was one of the things that worked a little bit quicker than I think most. But it was still a process to go through the background checks, the psychological screening, get the attorneys involved for the contracts, get the medical screening done, and then actually now do a transfer. And so that was about a 6-month process, which I know can be longer for most, but definitely a lengthy process and very involved. And so on our first transfer with our carrier, we got pregnant, and we were pregnant with our twins.
Nice. Oh, so they implanted 2, or
they
were
transferred 2?
Transferred 2. Okay.
Yeah.
They transferred 2.
Yeah, these are not, our embryos at that point weren't tested. We just had one set of embryos that were tested. So these were not genetically tested, so we didn't know.
Okay.
And the recommendation was 2 based on my history.
Sure. So was this a fresh transfer or frozen?
Frozen. Yeah, this was frozen.
Yeah, it wasn't. Was it they did? When my daughter, I thought it was a fresh transfer, but I could be mistaken in thinking that. I'm going to have to ask her again. Yeah.
It's definitely harder to coordinate a fresh transfer with a carrier, but it's impossible.
Yeah, and I thought that's what they did, which is very tricky. I mean, basically, how I'll explain it, and you can add into that with the medical knowledge that you have in my no letters behind my name, is just really getting these women's cycles exactly timed, exactly the same, so that can happen. And I remember them, I'm pretty sure I remember them doing that, so that it was. I could be wrong.
Yes, timing is a very important detail with all of it, of when to retrieve the eggs and when the embryos are going to grow and how they're going to grow in that setting, and then having a uterine lining ready.
Yeah.
For transfer.
Yeah, IVF sort of is what I'll say for both of them, for that to happen. So it's a lot. I don't think people realize how much it is. So you had twins, and pregnancy went well. She didn't have any problems. Were you able to go to appointments? Was she in the same state? Like, where was she? I mean, it sounds like she was the perfect one for you, but was she close?
No, I mean, we were in different states. We had to take a plane to get to her. We had kind of all different aspects of parts of the country, I guess, because at that time we were, our physician was in New York and our embryos were in New York, but we had to move them out of New York because it wasn't legal to have a paid carrier at that time, which the laws recently changed a few years ago. And so that was a whole process. And then where she lived in a different state than we did, but we wanted to be involved as much as we could. So we flew out every month to make the appointments, and she had to see like the regular OB and then a high risk OB just because of twins. And so we would try to coordinate those appointments on the same day. But we just wanted to be involved as much as we could, because that was a really big loss for me, for both of us, but for me as a woman and as a mom, just to be, I always say it was the best decision I've ever made and the hardest thing I've ever done, because I had to be apart from them for all that time. And that was something that I don't know that I handled it well, but it was something that I know most people don't have to do and to go through. And I still have to work through a lot of those feelings, but going through it at the time was very difficult. But yeah, everything went well, like throughout the pregnancy, surprisingly. And, and as a pediatrician, I know the risks of multiples. I've seen that side of it. And so, just with where we were with infertility and loss and just all we knew is bad, it was just kind of, moment to moment, just waiting and holding on and hoping that things would just continue to be positive, like go in the positive direction. And it did. And they almost made it to the full term, but just a few weeks shy of their due date, and no complications with delivery, no complications after delivery. They were in the room with us, and we got discharged at 4 days when they were 4 days old.
Beautiful. Yeah, that was the question I was going to ask. Did they schedule induction because of the multiples, or how was that? But it sounds like they did not do that.
Yes, it was a scheduled C-section. And it was supposed to be on a certain date, and we went a couple of days before for like the last appointment, and to like prepare ourselves, we had to get strollers or carriers and like all of that over there because we couldn't, travel with that there, and then we needed to travel back with them, so we had to prepare all of that. But then at our last appointment, our OB said, "No, it's going to happen today."
Oh gosh.
She just, based on, the exam and what she found, she's like, "Let's just do it today." And so that happened, but we were able to be in the OR and finally able to breathe once they took their breath.
Yeah.
Their first breath.
That's awesome. So you kind of indicated a couple of times just the grief, the loss that came along this entire journey, and that, some of it you didn't deal with well, and some that you're still dealing with. And I can understand that because I do, not personally, but just through my daughter, I think there's still times where she does grieve the fact that he was never able to carry and needed to use a gestational carrier, and just the grief and the hurt that goes along with that. Talk to me about that a little bit.
Yeah, so it's something that I try to address going through the process of IVF and that whole journey for several years. I kind of put my mental health, to the side, or not close up in front, right? Because it was a lot of medical, it was a lot financially, it was just a lot of that. But I knew it needed to be addressed. And so I had a therapist for like a few months at a time, or we had a couples therapist for a chunk of time. We did support groups together. I did support group individually, and it was either we couldn't do it logistically, or it came to a point where we're like, this is okay now, or not okay, but this is not working anymore, right, for us. And so, but we tried at least to sprinkle that in throughout. It just wasn't probably enough, because it eventually caught up to me in the form of anxiety, like severe anxiety and panic, and almost like PTSD. And so with not being able to carry, that was just next level trauma, which again, I tried to manage it the best I could during, but it was really after my twins turned a year where I had a panic attack, which I wasn't expecting. It came out of nowhere. And I realized it was because now in their first year of life, I was in survival mode of just caring, being a new mom, and now having twins and all of that. But I knew it was all connected to what I wasn't really addressing. And so I dove into therapy, individual therapy. It impacted our marriage. We dove into couples therapy. I did lots of different types of modalities, and through lots of work, I have healed, but it's still work. It's always work. And it's the unexpected comments or situations that kind of bring it up or trigger
that a little bit.
Yeah. And just having like the tools at least, or something to turn to, but it's so unpredictable. Sometimes it just comes out of nowhere, and it's hard.
Well, I'm glad that you shared that, especially for the listeners, that you did seek out support throughout the process. Many times people will not, and then after they've successfully had a child, just like you, all of a sudden it's like hits them, and much worse than probably what you experienced, because you did have some therapy and you guys did some stuff throughout the process, which I think is so important for the listeners to know. Like, we know you haven't achieved the goal that you set out to achieve maybe yet of having a child, but there's so much going on during the process that it's so important to seek that professional help outside of your doctor for your mental health. Super important. I don't think people realize how much our mental health is affected with grief, loss, and anxiety, and all of the things during infertility. So I'm glad that you said that so that people understand that that's super, super important for your well-being. And I just look at it as like, you want to be as healthy as you can when those children come. And that is how you can be as healthy as you can be. Your mental health is probably one of the most important besides your physical health. That sometimes also will decline as you're going through all of that as well. So did you end with the twins, or is there more?
And so we did, when they were about 2, no, before they turned 2, we started thinking about having another journey, because we had frozen embryos. So in 2020, my youngest son was born. We went through the whole process with a different carrier.
Okay.
This was a little different. We were in the same state, so we didn't have to fly, but we did have to drive a few hours.
Okay.
But definitely made a difference. So we were still able to make all the appointments. It was just logistically a little bit easier driving than flying. But then we also had the logistics of having our twins and having them come to the appointments with us, and or having somebody watch them while we go.
Sure. And I just want to go back a little bit with that. Like, you said at the beginning, the lawyers, the psych evals, all the prep work that has to happen before any of it begins. And I remember that too with my daughter. They did a lot of genetic testing because of who the gestational carrier was, which was a family member. And it was just psych evals and all of that, the lawyers. And I mean, I have probably shared this before on another episode when my daughter was on, probably episode I don't know, 2, 3, 4, way back. And then I actually had her daughter on, who is now 10, on episode 2, sharing, about her Aunt Emmy carrying her, and it was a really cute epised. But anyway, so you have 3, and are they all boys?
All boys.
Oh, wow. How cool is that? That is so neat. And so I know, too, that you have written a book. You said that at the beginning. It's come out in March. Share a little bit about that. Why did you write a book? What is the book about? Share a little bit about that.
So throughout my journey, even though I did seek professional help, I was very silent. I always looked at other women or other couples who spoke out openly and admired that, and just thought about how much courage they have and how much courage I don't have. It just got too hard. And even the small support that we did have, it eventually just kind of dwindled down, especially when the support doesn't show up the way that you need them to. Simple "how are you" goes a long way, and people weren't doing that. And I think a lot of people don't know how to support, especially with miscarriage and with infertility, and are always afraid of triggering, right? And so they're walking on eggshells and ignoring the elephant in the room, or just pretending, or saying the comments, giving the unsolicited advice to just relax or just adopt, right? And so that just added to my trauma, and I didn't feel seen, and so that just also added to my silence around it and the shame that comes with that. And so when we had our twins, I did not want that shame to be passed on to them, and they really gave me the strength to break my silence. And we wanted to be really open with them and share their journey, our family journey, and not have anybody else either tell that to them or have them figure it out later, or just have it be a secret or anything like that. So from day one, we've been open with them as best as we could, explain everything. That gets different, as they get older. The conversations continue to happen. They just change a little bit, and they understand. And so I looked for books to explain, for children's books, right, to explain that we could read to them for having a carrier. And I was able to find one that was really, really, really nice, that helped with that conversation. But reading is really important for us, and not only as a mom but as a pediatrician, I know the importance of reading and literacy. And so we read to them every night. We continue to do that. And I noticed that there weren't a lot of books there weren't any really books that represented them, that represented our family. And I didn't want them to not see themselves represented. They could see themselves represented in other ways, but in that specific way. And also, as I continue to get the questions, even to this day, with, are you going to try for a girl? Are you going to have more children? Like all the invasive questions, or the comments about my body after having twins, and just people not knowing and not being educated, right? And I would always say, oh, if they only knew. And that eventually turned to, I should tell them, I should say something. And that started the whole process of me looking into how I can write a book really to represent our family and our journey. So they inspired me to do that. But, I was motivated to have all types of different families represented. And so that's where this book, Every Family is a Tree, came along to really have representation and have everyone feel seen, all children, and to have that educational portion to it for parents or caregivers or whoever's reading the book. And so I touch upon families with no children, because that's often not spoken about, whether it's by choice or by consequence. Having a carrier, having a doctor help with IVF, adopted families, foster families, single parent families, families with two moms, and I try to encompass every type of family that I could think of and represent it in this book.
I love that. And what's the name of it again?
Every Family is a Tree.
Every Family is a Tree. I love that. For sure. Is this at your office in the lobby of the waiting room of your office?
No, I do telemedicine, so I don't.
I envisioned it on the table for everyone to read.
I would if I had.
Maybe some other offices will do that for you. I love that. I do remember, I don't have any idea what the name of the book was, so I won't reference it here. We'll reference your book in the show notes and everything. But I do remember my daughter having a book for my granddaughter, reading it very early on to her to explain that her aunt Emmy carried her. And on the episode that she was on, she just said, Mommy's body could not carry baby, is what she would say. And that she has 5 siblings. She has said she has 3 brothers and 2 sisters, because of the 5 losses, so there would be 6 total. And so interesting, so cool. I love talking to little ones because they will just say what they believe is true. I believe it's true, so to me it's true. I believe her that that's what their family is made of. And that the book that she read just from the very, very beginning explained to her they did not want to keep any secrets from her. They wanted her to know how special she was and is. So I love that. You've written this book for other kids that have families that aren't the typical, ordinary. They're all great families, for sure. So I love that you've done this. And it came out, you said, in March. Where can people get the book? Where's it at?
So it's on Amazon.
Okay.
And Barnes & Noble.
Okay.
I guess a link to order it. Yeah, and I have it here.
Oh, it's beautiful. I love the cover. So did you, you wrote it? Did you do all of the illustration and everything in it as well?
No. I had the vision.
Are you?
Yeah, no, not that talented. And even writing a book, that's a whole different learning curve. So I went through a publishing company and worked with them, and then they had access to illustrators. And so I had the vision, I had what I wanted to and how it wanted to be represented. And then she brought it to life in the book from my illustrator.
Nice. That's beautiful. I love it. I can't wait to get it. And because I am always, as you see behind me, if you're watching on video, lots of books. I have lots of children's books that I like to share with people. So yours will become on the shelf here too for me to share with others as well as on this podcast. Anything else that you would like to share before we conclude on loss, grief, that kind of was something that really, besides you had already said about a year out, that kind of caught you off guard, that you really had no idea that there would be such significant grief and loss with your entire journey and even after your journey starting a family?
I think for me, I believed up until a certain point that, like I said, everything happens for a reason, and there comes a lot of pressure with that. And I know it's a way to cope as human beings with grief and loss, but it applies when things make sense, right? And then when it stopped making sense. It no longer applied. So I changed my perspective on that to say not everything happens for a reason. Like there may be no explanation, there may be no reason, and to just kind of not have that pressure on yourself and that judgment for not, finding out what the silver lining is and how to turn it around and, all that, to just remain positive, because that's a lot. That's a lot to do in the grieving process. I also learned all types of emotions that I never even thought existed, and things that added to that shame and felt really inappropriate to feel. But understanding that all the feelings, like there's no good feelings, there's no bad feelings, they're just feelings, and it's okay to make space for all of that. And it's actually healthy to make space for all of that and to not just kind of suppress it and let it coexist and come through. And then just in that, just being kind to myself. I have to learn how to be kind to myself. And so I definitely encourage anyone who's grieving any type of loss just to be kind to themselves, give themselves grace with those feelings, with the thoughts, with the things that, you may be judging yourself about or thinking you shouldn't be even going there, but it's normal and you're not alone in the process.
Beautiful. Beautiful. I love that you said that. I'm going to just reiterate a couple things that I really love, like all the feelings, like really just acknowledging all of the feelings for sure. And of course, you're not alone. I love that. And I think too that giving yourself grace, and especially giving yourself grace that when you're going through it, that you said everything happens for a reason. I think it's a really hard thing for people to hear and take on, especially when they're in the thick of it, I'll just say. Many times we can find that reason years after, but when you're going through it, not so much. That is really hurtful to say. It's really hurtful to hear for people. And so just for the audience, for the listeners, not a good thing to share, not a good thing to say to people that there's a reason behind all this, that you're going through this, and everything happens for a reason. No, not a good thing. I think we personally have to discover those silver linings, those reasons, and many times it's years after. Yeah. I mean, the reason now is you have these 3 beautiful boys, but when you're going through it, no, not so much. It's too hard.
Right. Yeah, and it's hard to find a reason for loss, and miscarriage and things like that. And, like it was a stepwise approach to get to where we were, but it just doesn't feel like, even now years later, it doesn't feel like there was necessarily like a reason per se for that, for the trauma. And I think that's okay to not know the reason. It's just took a long time to get to that point of thinking that that's not, it's okay to not have that reason always.
And I think sometimes the reason could be, for many, is just the opportunity to share with others to support and help them. And you're doing that by being on the podcast, and you've also done that by writing a book. So many people won't do those sorts of things, but they are very beneficial and bring some reason to sometimes to what is happening. Really by sharing that and finding, I'm going to say in air quotes, some good in what you've endured by sharing it to support other people. Not always easy, being silent as you talked about, but I'm so glad that silence did not continue, that you have and now are still sharing that journey to support and help other people and every individual. So I appreciate you so much for coming on to share, and I'm glad you've broken your silence for all of the listeners and all of those that are going to purchase your book and are reading your book. So thank you again so much for joining.
Thank you. Thank you for saying that. I appreciate that. That brings me comfort and helps with my healing. So thank you.
Yeah, you are so welcome.